Hi guys, and welcome to SciSolved. I am Matthew and this is my friend Arthur over here, and today we'll be talking about the myths related to COVID-19 vaccines. So let's start off with myth number 1. A vaccine won't be safe. No guys, vaccines will be safe. Vaccines have to go through at least 4 different phases before they are approved for our use. So guys, after the vaccine is produced in the lab, it is immediately tested out on animals to find out if there are any side effects. It is then tested out on humans in 3 different phases. In phase 1 of the human trials, it will be tested out on about 20 to 30 participants. If there are no side effects on these participants and it is deemed to be safe and effective on these participants, it will then move on to the phase 2 of the human trials, where it will be tested out on an even larger number of participants. Again, if there are no side effects and it is deemed to be effective on these participants, it will be tested out on thousands and thousands of participants in phase 3. For example, the Oxford University and AstraZeneca vaccine is currently being tested out on 30,000 participants. Currently, there is one vaccine that is being submitted for regulatory approval. This is the Pfizer and BioNTech vaccine. Review of the data suggests that this vaccine will have about a 94.5% to 95% efficacy rate. Another vaccine that is showing promising results is the Moderna vaccine, which again shows an efficacy rate of about 94.8%. Myth number 2, a vaccine will be rushed. No guys, it will not be rushed. Vaccines have to go through these 4 phases mentioned earlier before they are deemed safe and effective for our use. Also, scientists have been working round the clock and intercollaborating together to make sure that they have the best research available there and then, meaning they upload the research immediately for other scientists to view it. Myth number 3, vaccines trials being paused are a bad thing. No guys, they are not a bad thing. If any patient during the trial either dies or develops a serious side effect, the trial has to be paused. The researchers will then review the findings and review why the patient either died or had that side effect, and if it's deemed that it's not due to the vaccine, the trial will then be restarted. This shows that the researchers have integrity and are transparent with their findings. Myth number 4, vaccines will make you more vulnerable to illnesses. No guys, they won't. They won't cause neither other diseases nor will they cause autism. We have been saying this, and scientists around the world have been saying this for years and years. The whole point of the 4 different phases of clinical trials mentioned earlier in the video is to make sure of just that. Myth number 5, a vaccine will solve everything. One reason is that the COVID vaccine might only be effective for a certain period of time, just like with what happens with the flu vaccine. You know, we have to take the flu vaccine each year because viruses mutate. Professor Ruhul Shaheen, head researcher of the Pfizer and BioNTech vaccine, said that life will most likely return to normal in winter of 2021. This is because we need enough persons to take the vaccine so that communities can build up immunity to the virus. So it's most likely that we will have some kind of restrictions till winter of next year. Myth number 6, a vaccine will be ready by the end of the year. We are getting close to a vaccine. However, it is not ready yet. It still has to go through regulatory approval. However, there are other hurdles that we have to go through. One of them is manufacturing the vaccine and getting it to the people. Meaning we have to organize a vaccination campaign and get the vaccine out to the public. So for now, it seems that we have to make use of other restrictions to keep us safe, such as wearing a mask and social distancing. Thank you, that's been my time, and see you on another episode of SciSolved.